Good afternoon, everybody. So today we're going to be talking about how our process of setting up a support group for vulnerable people. Uh, what's a support group? A support group is basically a kind of big brother or a big sister, a big family around to help you uh, look at things a little more differently, cope with things a little more differently, help and be there as a support system, as a call helpline whenever you have anxiety or trouble or you need some help. Or it could also be vice versa. You could be the big brother, you could be the big sister, you could be the big family, helping somebody who requires the support. You have got good best practices that you can basically talk to others about. When we talk about vulnerable people, it could be anybody. It could be somebody who has dementia, it could be somebody who has Parkinson's, neurodiverse diseases, mental health. It could be somebody who is a young person like me, who's had a fall or needs support because of, say, cerebral palsy or learning disabilities, autism. So these are kind of people who we are looking at building up a support group about. So just to kind of introduce myself, um, my name is Dyson. I am a care trainer and a care advocate. These are some of my qualifications and training that I've done in the past 20 years of my experience in care. But the important things to kind of keep in mind is that I work currently in the field of care. I am also the director and founder of Jijivisha, which is a startup that we're building up in India around care, basically looking at the concept of care standards, which I'll talk about in a bit, and also build about the foundation on care training. Not just formal training with regards to care personnel, but also with regards to people who look after their loved ones, the people who have concerns around looking after their vulnerable communities. So some of the key concepts of care, which we have to look at, because this is from an international point of view. I'm not looking at it just from an India point of view. In India, I think the concept of care is still relatively evolving because it's largely medical care that we look at when we talk about care. Of course, some of you might have exceptions in terms of having experience with care, but in the larger general focus, care is still not a legal requirement in the country. In India, for example, like in the UK, for example, we have something like a Care Act. It governs and determines everything around how individuals' preference, choices, and values are met. From a person-centric point of view. So that is one of the main, statutes of how care is delivered internationally. Now, there are so many other components within the focus of care. We look at empathy and compassion. Now, that is something that is a must. If you don't have empathy and compassion, how are you going to look after somebody else or support their needs? And this can be either, this is something also we can measure. We do assessment tests for care personnel or even with, loved ones if they want to kind of understand where they want to improve on or where are the concerns around coping skills and support needs. Then the other aspect is looking at dignity and respect. Now, this is something that we say, okay, fine, because India has a cultural norm and, we are religious, we have this ideal of, valuing elders and other things. But then sometimes what happens when we do care, we tend to do things for them because we think that is best for them. That is actually indignifying and disrespectful. Let me explain how. Imagine if you have you have your father who's basically been independent all their life, and now they are having some issues with their fingers or muscles, or maybe remembering things. They're not able to pop in their medication accordingly. You start doing that for them and keeping an account. So they start feeling that okay, I'm feeling. I start like as them as individuals start feeling a little more deprived. They think they're now dependent on you. They think that they're not. They might be feeling useless, no purpose. So it's important to kind of understand that working with them to help them continue to do certain tasks with some support from you encourages them and dignifies them. It keeps their respect, keeps their belief system intact. Because that's one thing that is important from longevity point of view. When you deliver quality service, to a client or to your loved one, we have to keep these things in mind as well. So that's something that to be kind of kept in mind as when we talk about the support groups in care, we kind of build it up. We look at other things like choice. For example, your father might ask for something that might not be in appropriation, maybe to their diabetes or their blood pressure. But we have to look at choice from an alternative perspective, from looking at the best interest. So, we can talk about these aspects as well. Relationships become very important, not just formal relationships as, okay, father, mother, brother, sister, but also your relationships with key community individuals like doctors, nurses, pharmacists. All these relationships are important, and that again becomes person centered. Then the last few points are basically around confidentiality, consent, safeguarding, best in the mental capacity. Now, the last one is something that is still largely absent in India, but it is something that we take for granted a lot as well, because we tend to think, okay, this person is elderly, he doesn't have the capacity, let me decide for them. Again, it is somewhere related to dignity and respect, but this is something that we also need to kind of have more understanding, and we will kind of also build up these values systems during our trainings as well. Now, safeguarding is an interest area for everybody. We are trying to look at protecting our vulnerable people from any harm. Could be financial, it could be abuse physically, it could be sexual, it could be emotional, it could be organizational. So, there could be so many varieties that are there. So we need, and also physical abuse. So we have to kind of understand these aspects and then work around these things to protect our vulnerable people. Most of the times today we see a lot of financial abuse happening. Somebody's just messaging somebody on the phone, we're not aware, they can't they so we have to try to look at protective systems around this, and we can discuss about this. There could also be safeguarding concerns. You have a client or a parent who is having dementia, and you start locking them in the house because you're concerned about them wandering around. It's a big safeguarding concern. I mean, you should not be locking somebody in their home, but you have to find systems around trying to protect them so that they are still at home and they can this, because dementia clients are known to jump out of windows, start breaking down the door because they feel trapped. They don't know what's going on. So, it's also kind of keeping those things in mind. I've had personal experiences around this, and believe me, locking people up in their homes is not safe. So, we can talk about that later on as well. So, these are kind of some of the things that we talk about in the care standards. We have different aspects that are there, and it's a full-fledged training curriculum. We train for about 3 to 5 days, but with the online support group, we can have kind of like individual sessions which can be done, and we'll talk about how we're planning to do that as well. Now, coming to the core focus, the support group, what is our objective? We're basically trying to create a platform for discussion where we are going to be supporting each other to continue to support our loved ones. I mean, that's very important. The key word is supporting our loved ones. So we are not able to do things on our own. We tend to say, okay, fine, I will do this all for my family member. You get stretched out like a rubber band. It's the same thing when you work with your job, right? It's not one person who's able to do everything. You have to work in a team. You need support. So likewise, when you are your only family member who's looking after your loved one, you need to see how you can ask for help from immediate family members. Of course, family dynamics also unique. You might not be able to, you might have tried and tested, but there are ways to kind of build up these support systems even better, where you get some help for somebody who's able to be help. Secondly, you can look externally from your friend circle, community resources, and then looking at groups like these, because you can have support from, say, technical mentors. Like I would be one of the technical mentors initially, who'll be on board, training you, giving you all guidance, looking at how concerns around your coping skills would be, determining where referrals could be made, and all other support in the community. You would also have moderators at a later point in time who will be moderating the groups to kind of see, okay, fine, who has got the technical know-how about certain experiences in a group. Somebody might have worked with their loved ones for, say, 10 years versus you who have just entered today, who has just started supporting their loved one. So there's a lot of experience dynamic as well. But all of this is basically to be discussed when we look at things from your concerns point of view. So ideally, I would basically, talk about things around what your concerns would be. We take turns to kind of talk about some of the issues you face on a day-to-day basis, about your loved ones, about or about your client. We talk about what's going on well, and then we look at what are some of your coping issues and anything else that is basically there from that perspective. So that will be like a first official, group support, and then this will be the basis of how we kind of continue these support groups from a long-term point of view. Because the idea is to look at building up on your needs. It's not something that will be driven by the organization or by the support group moderators, but it will be based on what your actual needs are, and we discuss that accordingly. Now, I would like to mention that we will request for consent formally. It will be done in writing. We will send you an email with a document, and then you will have to basically send that to us. It will be documented. But it is also important to understand that confidentiality, anonymity, and security are very important to us. And this is also your right. If you do not want to be a part of the support group, we can also look at alternatives where you have one-to-one support, and we can determine how that can be done, on a long-term basis. So that's something that's there. But again, when you're in the support group, say, or you're on a WhatsApp group or you're in a Facebook based group, and you're actually discussing about certain concerns, you would also make sure that you keep all your personal details private. So you may not decide that you want to talk about your name, the name of a client. We would say don't discuss that. You could put initials. Uh, of course, it's difficult to sometimes, you will be on WhatsApp, so your number will always be apparently there. But we will not be providing any of that information to anybody else. If you do get a call from anybody claiming to be us, you have to make sure that you protect yourself, because we will not be contacting you that way. We will be contacting you to official route and channels, which will be done in your documentation in your consent form. Now, what will be part of the content in the session plan? So, as I mentioned earlier, the groups will eventually fragmented to support specific groups. Like, for example, you might have a group that was looking at dementia, or there might be a group that has dementia with behaviors that challenge. Again, a specific fragmented group where we talk about people who've got advanced dementia who then have behavioral concerns. And then the group will have different people from that particular setup who would have had already loved one based experience around that. And then we will have discussions about it. So we are all supporting each other to actually build up that support network, not just from looking after the loved ones, but also going through the trauma, of how it is emotionally disturbing to all of us when we look after a loved one who's suffering from advanced dementia. So we're there to support each other, to kind of be there for each other. These are kind of things that we will basically build up from your basic knowledge. Now, initially sessions will be very open-ended, where I mentioned about the plan in terms of what the structure will. But then we can also talk about experience sharing from or specific topic related things. For example, something that's new in dementia is now the blood test for dementia, and how the diagnosis of dementia is going to be very simplified. So as and when it starts getting rolled out internationally, we will then discuss that with you all. So we can basically have like a half an hour session, not taking too much of your time, where we can basically talk about these things. We can say, okay, fine, these are where the resources are available. We'll say, if you need access to dementia based resources in a community, these are basically what are there. If there is, say, for example, increasing falls risk, then what do we have to do around that? So you can talk about those things. We can talk about nutrition, hydration, and how critical and valuable that is in dementia. We can talk about preventing UTIs and respiratory tract infection in dementia. I'm only talking about dementia because I'm using it as example. We can look at it from, say, autism point of view. So how do we kind of work with clients with autism? How do we look at, say, for example, the importance of autism counseling in somebody who has autism and growing up with autism, and how it is important to kind of help them build up their programmable components, in the long term. Likewise, learned disability, motor neuron disease, Parkinson's. So different groups will have different specific topic based things, because it's all about learning and building up your knowledge. So tomorrow when you all become, group experts, then you all can then become moderators or, help other people. So it's basically about building up that knowledge and culture of care into the community. Now, we will be looking at a membership mechanism from the short term to the long term. Initially, we are not going to be looking at this as a fee based structure. we will look at membership voluntarily. We will not just add you to a group. We will ask you, we'll send you a consent. We want to make this a solution-based support system, where participants basically follow the ethical guidance and gain support. That's where the moderators and people will be involved. We will always make sure that we ask all of you to message on group. If anybody contacts you outside the group, that's your prerogative to ignore or block or whatever. So we want to make sure that's there. We will try to make up systems where anonymity is an important aspect. So that's something that we will work on. Initially, the group is free to join too, but in the future, we will look at something like an annual maintenance fee, because we will have to kind of look at expenses around managing this. And again, our prime importance is affordability. That is why we want to kind of make this as affordable as possible. So, we are suggesting, this is just a suggestion, that an annual maintenance fee of, like, say, 1,200 rupees a year. So, at the end, what we're trying to do from all this is to achieve these two goals. We're looking at trying to build up, uh, assisting you to live life to the fullest through training and support. So, care training and client-centric care become one of our main important, statutes. So that's one of the things we want to build up. So we want to look at things that is affordable. We want to see things that as least intrusive as possible, because we want you to be in control of all this support mechanism. We are trying to look at evolving person-centric solutions. They're not only just going to come from us, but it's going to come from the group itself. You might come, they say, there's a saying, right? 10 heads are better than one. So if it's just Jivisha basically providing you that support, it's not going to be really valuable, but it comes from your peers who have similar kind of experience or more. Their lived experience is going to have a better impact on your life, because as peers, they'll be able to determine and deliver those kind of solutions to you. We are also looking at it as a long-term relationship, not just from our point of view, but also in terms of y'all with that support group as a family tomorrow, supporting you in this journey around life. Not just when you have your loved one ill, when they go into, say, severe distress, or when they pass away. So we want to kind of look at this journey in a whole tangent, because you will need support as a caregiver even beyond. It is not easy losing a loved one. It is not easy going through what your loved one is going through in distress. So it's very difficult to kind of do that. I mean, I work in the sector and I've kind of seen that. I've also lost loved ones, so I know how it feels to be in that certain situation. So that's one of the things we're trying to look at from a long-term point of view. And at the end of the day, we're looking at a better quality of life. So not just for your loved one, but for you as well, because we tend to sacrifice all ourselves to look after our loved ones, because they have looked after us when we were growing up. So we want to make sure that, we give that back to them, because we owe them that as much, because they are family. But it's also important to live your life. It's important to kind of continue building up your life in spite of the fact that, yes, there's a loved one who has that support, but you should not put a stop to your own life because somebody is ill or somebody is sick. But we find ways, we find alternatives. It is challenging, but there is always a possibility in terms of some level of give. So we'll work towards those aspects. So I thank you for your participation today. We will take questions in a while. But in case you want to kind of contact us with regards to anything, these are all our contact details. Feel free to send us a detailed email, or WhatsApp, or join us on Instagram, so we can then discuss things further from there. So looking forward to hearing from you. Thank you.
Yeah, thank